Thank you very much. Thank you. And thank you, Ilaria, for the introduction, which will let me go through my introduction as well. So Ilaria has just shown us how important reflex testing is for Delta, and that all patients that are HBsAg positive at least once in a lifetime need to be tested for anti-Delta. We have been doing some work on reflex testing in Andalusia, in the part of Spain where I come from. We published this very recently in scientific reports, and here you can see from a pre-reflex scenario in 2018 and 2022, where only 18% of the patients were tested for anti-Delta of the HBsAg positive patients. We moved with a very easy intervention, just talking to colleagues and doing some educational sessions. We moved to nearly 100% of the patients that were HBsAg positive offered and tested for anti-HIV antibodies. So having this excellent this excellent experience in Andalusia, we exported this to the whole of Spain. And here you see what we are running, and we are calling the DDR Spain study. There you can see that this is an ambispective study. It has two phases. The retrospective phase is already finished, and we are currently running the prospective phase, which is running for 18 months and will end by the end of this year. There you can very, very quickly read 5 main objectives of the study. This is a program that is sponsored by Gilead, by the Spearhead program, and also by the Spanish study group on viral hepatitis of the Spanish Society of Infectious Diseases and Clinical Microbiology. So I'm just going to show you very quickly 2 of those 5 objectives, how we have been done, or how we are doing, implementing the double reflex diagnostic strategy in Spain. And we have data, as well as Ilaria has shown, on the anti-HDV prevalence and the prevalence of chronic Delta infection, and which are the characteristics of these patients. So for the retrospective phase, what we did is that we asked there in the slide you saw 80 centers. Now we have more than 80 centers. We're around 88 centers all across the country. Because when centers hear that we are doing this study, they want to join. And it's a very easy study. We just ask them for the numbers to establish the diagnostic cascade. And we do this in a very easy Google form or Google Doc formulary. So this is the data for the HDV diagnostic cascade in Spain for 2022. There you can see nearly 19,000 HBsAg positive, and very similar to what Ilaria has shown, roughly 56% of the patients had an anti-HDV test. The prevalence of positivity is 5.6%. Of those, only 3/4, which means around 75%, had a HDV RNA test, and the prevalence of chronic infection in 2022 was 40%. So this is what we got in 2023. There you can see that there are still a great number of patients, nearly 20,000 patients that were still not tested for anti-HDV, but we significantly increased the number of tests of reflex testing to 72.5%. And there you can also see the prevalence of anti-Delta, very similar again, around 5%. And the uptake of HDV RNA, which also increased significantly in year 2023. And for 2024, which is the last year that we have the cascade, there you can see that, of course, the number of patients of HBsAg positive patients that are screened has decreased, because a lot of patients are already tested and we don't retest. And there you can see how the reflex testing strategy is now somewhere around 86% for anti-delta and above 90% for HDV RNA. So very little intervention, very, very good results. Very easy to get all our colleagues doing this in a very easy way. This is, if you look at the whole map of Spain and you look at what we call here in Spain the autonomous communities, there you can see how the evolution through 2022, 2023 and 2024 has been. And there in red, the more red you see, the more close to 100% of implementation of Delta double reflex testing. So there you can see that we're doing very well in Spain right at the moment, but we'll still have room for improvement. Specifically in some autonomous communities. And for Delta RNA, there you can see the map, and in 2024, almost all the map is in red. So almost all sites have availability to test for Delta RNA in Spain. So for the prospective phase, this has started in the third quarter of 2024 in May and will run until the end of 2025. We have already enrolled 288 patients from 43 hospitals all around the country and 11 autonomous communities. For this, we need to have the approval from the ethical committees, and this is why not all the sites that are participating in the retrospective phase have already joined their prospective phase. So these are the characteristics of these patients, and just to go very, very quickly through them, I'd like to highlight the 18% of HIV co-infection, the 22% of HCV anti-HCV co-infection, and the almost half of them have advanced fibrosis. There you see the FIB4 score for the patients in green that had a chronic active infection. And you can also see that the predominant genotype in Spain is genotype 1, but we will leave this for another abstract that we will show more specific data tomorrow, and Martha will take care of that. And this is just to end, which is the uptake of HBV treatment in these patients, and which is the fibrosis, the documented degree of fibrosis again. And as we could expect, the patients, there you can see that almost half of the patients have F3 of F4 fibrosis score, which is really something we need to take care of, because this documents an advanced degree of fibrosis. So that's it from our side. I think this is, of course, the largest study of its kind in Spain, still revealing significant disparities in HDV testing across autonomous communities, as we have seen in the previous slides. The variability in adherence to reflex testing highlights the need for standard national guidelines and expanded professional education. Very happy to hear from EASL that double reflex testing for Delta is now recommending it in the EASL guidelines. And of course, we are right now producing a new version of the Delta Spanish guidelines, and this is going to be in it. So it's very good to hear about this. And of course, our findings show a high burden of disease, and with a very high frequency of HIV and Hep C co-infections and advanced fibrosis in many patients. So strengthening and early detection and harmonizing diagnostic protocols will, of course, improve the equity, patient outcomes, and disease management across Spain. So thank you very much. I acknowledge all participating centers. Ana Alberola is the main student who is helping us with this work, and Adolfo Salazar and Antonio Aguilera, who are coordinating it, and of course to sponsorship from Gilead and HepSane. Thank you very much.
Thank you. Thank you.